Okay. Happy July. We are in the thick of summer here in DC. And for those of you I haven't met, this is Dr. J. Kim. I'm coming to you from Fairfax, Virginia, just outside of DC. Thanks for tuning in. First things first, I want to introduce you to the promo of the month. We have a summer skincare set that is valued at over $200, which we are offering. So for your chance to win, please text the word FIRM to our office number. It's right here, 703. Diet. One of the other products we will be giving away is this Hydrating Toner from Pca Skin. Again, this is a toner, so it's hydrating, it's moisturizing, feels very good on the skin. Nice way to start your skincare regimen. Since we're talking about the neck today, we are offering the Elastin Restorative Neck Complex. So this is Elastin is a skincare brand. It's relatively new on the market, and their kind of MO is that their skincare products work on Elastin, which is the protein in your skin that gives you the bounce back. So we tend to lose that over time. So Elastin's products, including the neck cream, are very good at helping you get that bounce back to where it was. Okay, and last but not least, the fourth skincare product we're putting in the box is Elta MD. It's the UV Clear, which goes on very nicely. It doesn't cake, it doesn't roll when you sweat, and it's not too thick that it gets in the way of your makeup. So nice product to have. This is a mineral sunscreen, so the main ingredients are zinc and titanium. You might have heard recently in the news that there are other sunscreen products that are being taken off the market because of potentially cancerous ingredients, such as benzene. So these are benzene free, these are paraffin free, they have not been animal tested, they're only human tested. So Elta MD is a great brand, and among their sunscreens, Clear is one of the better ones that I really like. So for your chance to win, please text FIRM to our office number. And with that, we'll get started on neck, part one. So people come to my office with concerns about their neck. So some of the concerns that you may have are wrinkly skin or saggy skin. You may have a heavy neck. You may have a kind of a blurred contour, as it were, not a snatched neck or jawline. You may have a little bit of fat from here kind of coming down over time, or you may have prominent muscles like these, okay? And what can happen over time is that those muscles start to relax and sag, and you end up with a turkey neck. So these are some of the issues that patients come to the office concerned about. And so today we're going to talk about the non-invasive or less invasive things that we can do to help certain issues of your neck. Obviously, as a facial plastic surgeon, surgery is what I do, but I also offer less invasive services for people who would not really get a dramatic change from surgery because the changes aren't that, the aging changes aren't that bad yet. So first things first, the best thing you can do at home every day is to have a great neck cream. Now, why would you want a neck cream as opposed to just putting your face cream on your neck? Well, the main reason is that, we make oil on our face skin, so the face cream and products that you use should be tailored to, whether your skin is oily, dry, or combo, etc. With your neck, generally, your neck skin doesn't make oil like your face skin does. So your neck needs an extra protective barrier in terms of what you apply for your skin. So like I said before, we have a couple neck creams, but the Elastin neck cream is really good. The price tag is not inexpensive, but a little bit goes a really long way, and It's really one of the creams that I like the most on our shelves at the office. Okay, so you're doing the neck cream every day, but you still have concerns about, let's say, some of the lines that we make. Okay, now we're on our phones, we're online all the time, so our tendency is to go like this, and you're looking at your phone like this, and so these necklines get reinforced, which is a bad thing. And whatever you want to call it, we can call it tech neck, for want of a better phrase. But what ends up happening is that these can get really deep and they can look dark. Okay, and so what I like to do for some of my patients is actually to dilute some filler and to put it in the lines directly and overall rejuvenate the collagen making process of the neck. Among the fillers that I like to do this with, Radiesse is the go-to. So Radiesse is made of calcium, and just like your bone. So when you mix Radiesse and dilute it out with saline and then you inject it into the neck, not only are you filling some of those crevices that your necklines have made, but also you are awakening the collagen making factories inside your skin. So there's twofold of so there's two different ways that Radiesse filler can help your neck skin. Okay. Some of the other things that we can do for neck skin, if there's a little bit of loose, like right around here, you might notice into your 30s or even 40s, without heaviness, just kind of that starting to sag feature that you have, microneedling is a good option. So microneedling, you may know, I featured it before, is the process of actually making small injuries to the surface of your skin with very sharp needles. And what that does is it creates a small tunnel for very good skincare products or PRP to go into your skin and to rejuvenate it. And also, the injury itself stimulates your skin to make more collagen. So it works in those two ways. Now, when you combine microneedling with heat in the form of RF or radio frequency, what that does is, as the needles enter and create injury to your skin, it also makes heat go in through those needles, and what that does is it shrink wraps your skin a little bit to give you that little bit of tightness. Okay, and this is good for people who have relatively thin necks, who have mild sagging or mild crepey skin. This does improve the skin quality as well as the texture and the tiny bit of sag that you start to see as you go into your 30s and 40s. Okay, another non-invasive or less invasive option is laser. Now, your neck skin is subject to damage from the elements, including the sun and brutal winds and things like that. So in order to give your skin a nice refresh, what you can do is do a resurfacing laser. Okay, one of the options we have is erbium. Another option that we have is carbon dioxide. And basically what that does is it peels off the first few layers of skin, and as your skin responds to the heat and brings the new skin to the surface, you get a nice rejuvenated look. Okay, so those are some of the options that we have for skin and for wrinkles of the neck. So you have the diluted filler, you have microneedling with radio frequency, and also lasers. Okay, so if you're just joining us, I'm Dr. Kim, and we're in Fairfax, Virginia, just outside of DC. We're talking about necks, part 1. Stay tuned for part 2 next month. And just text the word FIRM to our office number to get a chance to win a skincare bag worth over $200. Okay? So now we'll go to different features of the neck. Okay? Some people have fat around their chin and neck. It's very hard to get rid of this fat, no matter how much you diet and exercise, no matter how much you do this or that, and try to make your muscles around your neck stronger and burn the fat around it. It's very stubborn, so what you can do to kind of speed up the process is melt the fat. Okay? Now, we have an injectable that we use in the office called Kybella. Kybella is, you draw it up and you inject it into a grid-like pattern across the area of the fat that you want to melt away. this is good for people who have kind of that stubborn fat that doesn't go away, and if the fat, you can pinch kind of through your skin. Okay, this is superficial fat. This is fat that's on top of this muscle underneath. Okay, if the fat is deeper than that muscle underneath, Kybella might have limited effect for you. Okay, so I've tried Kybella on some of my staff, one person in particular, but what ends up happening is that, well, what you can expect is that there will be about 20 to 30 injections depending on the area that you would like to treat. That area gets red and swollen quite significantly, actually. It looks like kind of like the frog's dewlap, if you will. And during that time, it may feel a little sore, it may feel a little uncomfortable. Kybella is a really good option for younger people whose skin can bounce back. Okay? So I generally offer Kybella for people who have isolated pockets of fat or areas of fat in and around their chin or under their jawline, and who are relatively young, and you can kind of see that their skin has the capability to bounce back. If you have saggy skin and you use Kybella, it's a no-no, because you're kind of taking air out of the balloon, so to speak, and you end up with a more wrinkly balloon. And that's the last thing you want after you've had Kybella treatment. The other thing that could happen is that, usually Kybella requires more than one treatment. So you're talking about maybe 3, maybe 4 cycles of treatment, which adds up to 3 or 4 periods of downtime and recovery, not to mention 3 or 4 different invoices for you to have to pay. Okay? So generally, what I also offer in addition to Kybella, even for people who have younger necks with more elasticity in their skin, is liposuction. We'll talk about liposuction next month because it is technically a surgery, but that's my 2 cents about Kybella. Okay. Now, some of the other things that you may notice in your neck is not just the heavy, it's not just the crepey or wrinkly skin, but it's also these muscles right here. Okay? These muscles are called your Platysma muscles. And I don't know if they serve any real function for us humans, but it's kind of akin to the dewlap of a frog when they ribbon. Okay? So the platysma has a muscle tone to it, just like every other muscle in our body does. But when the muscle has too strong of a resting tone, it can look like this, even in younger people. Okay? And so what that can do is this super tight muscle can make it look like you have cords, or just kind of like, it just makes the neck look wider and more awkward. So what you can do for that is relax the muscle, and of course relaxing muscles you do with Botox, which is a nice simple shot in the office. And so what you can do is, if you have muscles here that have really strong tone, you can just pinch the muscle and put injections along the length of it, from just under the chin down to wherever the muscle has the tone. And over, a few days later, you'll start to notice a decrease in the tone and overall smoothing out of the neck. So in terms of muscle issues, that's one way you can go for the platysma. Okay. At this point, we'll take any questions from the audience.
One user asked, at what age should I start using neck creams?
So if you're old enough to, let's see, if you've started using eye cream, you should probably start using neck cream. So I know some people who start using eye cream in their college years, and at that point, the skin under your eyes is pretty youthful, very firm still. Okay, there's no real aging signs to it, but just like that, our neck skin at 18, 20, 22 is totally, nice, young, youthful, but it doesn't hurt to start using it then as a preventive measure. So over time, you're treating your neck to protect it from the elements that beat down on your skin through the years. So 20, 22, 25, anytime like that is a good time to start using neck cream.
Okay. Another user asked, how many sessions of microneedling or lasers is needed for the best results?
For microneedling or lasers, generally we recommend a cycle of 3 to start. So the heat or injury from either the microneedling or the lasers takes effect and has a continued healing process over the better part of 4 to 6 weeks. So we recommend that every 4 to 6 weeks you come back for a second treatment, and then 4 to 6 weeks later come back for a third treatment. You don't want it to be too soon, because then you're interrupting the best time frame of the healing process. But if you wait too long, like let's say you wait 2 months or 3 months, you're kind of you're kind of feeding the skin and tissues with a good healing process, and then you're waiting until it goes away, and then you have to restart again. It's very hard to restart the healing process after it's come back down to 0, rather than just continue to give it more gas, so to speak, as you go.
Okay. What is the downtime for the Botox that you mentioned?
The downtime for Botox in general is very short. If you have an injection or a series of injections, we do it most commonly for these kinds of expressions to relax those. For that day, we generally recommend don't exercise, but that night you can wash your face and do your normal skincare routine, and then the next day you can go back to full tilt exercise. So the downtime for Botox in general is very, very short. So for this area, you'll notice, the little pink swelling from the direct injection sites, but once that goes away, don't exercise that day, but the next day you can go back to full physical activity.
I heard that Kybella dissolves fat. Is that true?
Kybella is an injection to dissolve fat. Yes, that is true. So, like I mentioned before, for particular areas where fat kind of stubbornly, is very stubborn and doesn't go away regardless of your diet or exercise, it's a great way to melt away fat. Now, during the process, immediately after the injections, for like the first day or two, you'll notice some swelling, but that's kind of the inflammation that goes along with melting the fat away. But you do see nice results with Kybella, usually after 2 to 4 treatments.
Okay. Doesn't seem like there's any more questions, Dr. Kim. Do you have any last remarks for the audience?
Let's see. Nala is now 10 months. Her birthday's coming up in early September, so look forward to that. We will be sure to have a lot of pictures and footage. Otherwise, we're here in Fairfax, Virginia, and just outside of DC, and I think we're going up on 2 years of this office in November. So I really thank everyone for their support. Thank you to my family and friends, especially my wife, who is helping me get through all of this. Thank you for especially your support during the pandemic. It's a very tough time for everyone, but really appreciate your support nonetheless. And my staff and I have been very excited about what's going on during the summer, and look forward hopefully to beating out the Delta variant and really getting back to normal life. Can't say enough about everybody's support through this difficult time, and I know that there are much more urgent health issues rather than a little injection for your beauty, but nonetheless, thank you very much, everybody. Look forward to seeing you again on the next Instagram Live. We'll be at we'll be talking about the second part of the neck. Now, this will be slightly more invasive procedures, and so for changes that people who need changes that are more dramatic, that would be the way to go. Okay, please don't forget to text the word FIRM to our office number for your chance to win our skincare package valued at over $200. Again, thanks for your attention, and until next time, take care, stay safe, and have a blessed weekend.